All right, so this is the last section of chapter 7 on the skeletal system. And we're moving on to joints. Those go along with the skeletal system. So where two bones meet, that is a joint. Sometimes it's called an articulation. There are different kinds of joints, and we're going to go through them now. So the first one is ball and socket. Sometimes it's called spheroidal because it's like a sphere, but it's not totally a sphere. So it's sphere-like. These are, an example would be your shoulders. They have a great range of motion, so you can move your arm up and down, forward and back, side to side. And also your hips. You don't have as great a range of motion in your hip because the socket covers the ball, the head of the femur, much more. But you still have a pretty good range of motion. Unlike your elbow, you can only move it in the one direction. So the ball part, one of the bones has a rounded end, and then the socket part, the other bone has the complementary shape, like two puzzle pieces. Next, we have condyloid joints or condylar joints, and they move in an ellipse shape, which is like an elongated circle or oval circle. So it's similar to the ball and socket, except instead of a true ball, you just have a rounding on one end of the joint, and then the other bone has a concave section that fits over that oval part. This can do two axes, so you can go forward and backwards and side to side, but you can't like do much of a rotation. So an example of this one, if you look at your hands, the joint between the metacarpals and the phalanges, so like the bottom of your fingers basically, so that's what allows you to like wag your fingers back and forth. You can do more than just bend your fingers down to your palm, you can move them side to side. Next, we have a plane joint, sometimes called a gliding joint. This is when the two bones are flat surfaces, so it looks like a plane if you remember from geometry. This allows you to slide or maybe twist, but there's no axis here, so you're just sliding in that plane. So example here would be your carpals or your tarsals, your wrist and ankle joints, and that gives you that like gliding motion for a wave of your hand. And this is also found between your vertebrae. So how you can say like if you bend over, your vertebrae will slide and curve as you bend over. Next is the hinge joint. So this one, it works just like a hinge. You can move in one direction only. So your elbow is an example of a hinge joint. You can bend your radius and ulna back, so that your hand can touch your shoulder. And then you can bend it the other way. You can extend the elbow joint till you get a 180-degree line of your arm. But the hinge joint can extend beyond that. If you extend beyond that, that's called hyperextension. Bad things will happen. You'll sprain or tear some muscles, and you may even break a bone if your the hinge joint were to extend beyond that. The knuckles of your fingers are also examples of hinge joints, and in your toes as well. So again, same thing, your fingers can bend down towards your palm, but you can't bend them back the other way. They only go one way. Okay. Next is the pivot joint, sometimes called trochoid. It pivots. Basically, it rotates around an axis. So an example is your head. You can shake your head no, turn it side to side, and that's because the top two vertebrae, the axis and the atlas, they have a special, the atlas has the axis has a special protrusion that the atlas can spin around. The next joint is called the saddle joint. This one's very specialized to the thumbs. So we humans, you've probably heard we have opposable thumbs. So the saddle joint is responsible for that. So that allows your thumb to move like side to side and up and down, and you can rotate it, or well, not really rotate it, but you can circumduct your thumb, basically. And if you look at the two bones that make up that joint, one of your carpal bones called the trapezium, and then the metacarpal in the thumb, that each bone has like a saddle shape to it, and they lock together. So here's an example of the what all the bones look like. So over here, you can see like a more cartoon stylized drawing, and then here's what it looks like on the bone itself. So here's the ball and socket. So one side's a ball, the other side looks like a socket. And then the arrows show you the directions that it can move in. This will probably help you on the two practice worksheets if you want to pull up the PowerPoint as you go through the practice. Here's the condylar joint here. So this is the palm of your hand, the metacarpals, and then the phalanges. You can kind of see. So it's similar in a way, but you don't have, similar to the ball and socket, but you don't have the same rounded ball. Okay, it's more of a flatter oval type. Here's the planar joint. Okay, so flat surfaces, and it can move along the plane. The hinge. Okay, and you could actually see on the ulna, it actually has a little protrusion here that fits in the groove of the humerus. Okay, so it physically cannot hyperextend without injury. And then the pivot joint, here's the atlas and axis. So it just one turns in a circle around the other one. And the saddle joint here on the trapezium. Okay, and you can see this is the saddle shape. So you've got like two high ends, and then on the other side, you've got two low ends, and it fits together with a similar shaped piece. This is in your e-textbook, this chart. So this is just a summary of everything I've said, along with the types of movements that are possible with the joints. Okay, and here are joint movements. So they're described on this slide, and then the next slides like show a person doing those movements with the arrows. So that's the second practice worksheet you're going to do. And on that worksheet, it'll like show you if you move this way versus if you move that way with the arrows. So the joints are where two bones connect. And then when you combine those with the skeletal muscle system, that actually produces movement in the body. So these cannot move without the skeletal muscles, okay? But we'll get to that system in the next chapter. So what happens is the muscles have to be attached to two different bones. And then when the muscle contracts, it gets shorter and it pulls on one end of the bone, and then that causes a movement. But it's only in one direction. So you have an opposing muscle group on the other side that will pull the bone back to its previous orientation. So that's why, like, if you work out, you have to work out opposing muscle groups. Otherwise, you know, you have like huge biceps and skinny triceps, and your arms look funny. Okay. So the part that moves, the bone that moves where the muscle attaches, is called the insertion point. But the part that doesn't move, the bone that stays put in that particular movement, is called the origin. And those are specific to like that muscle in that particular movement. So you can't always say that the humerus is the insertion. Sometimes it's an origin. So some basic movement types. Flexion is one. That one's, most people have heard of that one because you hear flex your muscles. So flexion is when you take an angle, if your two bones are aligned, to make an angle, and you reduce that angle. So like if you hold your arm straight out in front of you and you bend at the elbow, that's flexing your bicep because the angle formed between your forearm and your arm has gotten smaller. You can flex your fingers as well. If you bend your fingers down towards your palm, instead of being straight, the angle has reduced. You flex your knee, you can flex your foot. your thigh, same thing. Extension is the opposite motion to flexion. So you extend the muscle and increase the angle between the two bones that make up that joint. You can flex laterally, so side to side, and that's when you bend your head and neck or your trunk. So it's a little bit different than flexing your appendages. Hyperextension is what I was talking about before. That's when you extend beyond the normal anatomical position. Some people, very few people, can naturally hyperextend certain joints because they're quote unquote double jointed. What that means is they have, it's a genetic difference where their ligaments that hold the bones together in that joint are slightly stretchy compared to everyone else. So they can slightly hyperextend. If you've ever seen someone do it, it looks kind of odd because you don't see it normally. But it puts these people a little bit more at risk of having their bones become dislocated because the ligaments are a little more stretchy. So there's a trade-off to it. The next two movements are ab and adduction. They're a little bit confusing because they're spelled almost the same way, but abduction is if you move a body part away from the midline. So if you were standing with your hands at your side and then you raise your arm directly out from you, kind of like you were going to flap your wings if you were a bird, that's abduction. But when you bring that arm back down to the middle, that's called adduction. So ab is moving away, the B away, and then add is moving towards. So the D is T. So I always think of them, they're in alphabetical order. So ab away, add towards, if that helps you keep the two straight. And here's a picture showing you. So flexion is this joint here has been reduced in angle versus when you extend, this has been increased. And then lateral flexion is if you bend the whole trunk. And then we have abduction, so you can do it with your legs too, not just your arms, moving outwards away from the middle line. And then add is moving towards the middle line. In typical years, we actually have a lab where we measure these movements and range of motions with one another, but because of COVID, we can't do that this year. The doctors do measure range of motion, physical therapists and chiropractors, things like that, because they're trying to see, like maybe you have arthritis, or maybe you had an injury from a car accident, or maybe you had a surgery and you're trying to get back a full range of motion. So it's basically like a giant protractor, and they'll measure the different angles of all these joint movements that you could make to try to help you get back to where you were before whatever happened to you happened. Okay, these are a little bit more specialized movements. So dorsiflexion, it's still flexion, you're reducing an angle, but dorsi refers specifically to the top of the foot. So it's an ankle movement, and basically if you point your toes to the air, like you try to pull them back and point towards your shin, okay, you've reduced the angle between your shin and your foot in the front, so that's dorsiflexion. And plantar flexion is the opposite. Plantar is the region on the bottom of the foot. If you point your toes straight down towards the floor, you've increased the angle between the shin and the foot. Rotation, we've kind of talked about this with the pivot joints. You move apart or on the axis. So like if you shake your head no. Circumduction, this is if you were to draw a circle. So if you hold your arm out straight and you did a windmill, so point your fingers and then draw a circle with your fingers while keeping your arm straight, that's circumduction. Circum, like circumference, you're moving it around in a circle. You could do it with your toes too. or a finger, you could circumduct with your fingers. Then if you hold your arm out in anatomical position, you can, there's supination and pronation. So if you're in anatomical position and then you turn your palm face down, so it's facing the back, that's called pronation. So your radius and ulna are actually twisted across from one another in that motion. And then the opposite motion, if you turn your palm back face up, put it back in anatomical position, that's called supination. So palm up, supination, palm down, pronation. And those are referring to your palms, your hands. So here's the supination and pronation. So in pronation, what will happen is the radius and the ulna actually cross over one another in an X. That's a common area for a fracture, a break. Like if you fell out of a tree, as kids falling out of trees, you typically pronate your hand to brace yourself as you fall. But what happens is because the radius and ulna are crossed, the shock of hitting the ground travels up, and those two bones, where they connect, they actually reverberate off one another and they break. Super common fracture. Versus if you didn't do that and you just fell or kept your hands supine, you wouldn't experience that break. And depending on how high you fell, you might have other bones break. But that's a common one because it's a defense mechanism we use to try to protect the rest of our body, like your head, from hitting the ground. Here's the foot. So if you point your toes up, there's dorsiflexion. And if you point your toes down, there's plantar flexion. Common for, like, say, ballerinas, they do plantar flexion. Here's circumduction. So this guy is doing a windmill. So the arm is straight, but he's moving in a circle. And you have rotation here. So if you hold your arm like in a 90-degree angle at the elbow, and then you can kind of like a clock hand, you can move it towards your chest or away from your chest. That's lateral and medial rotation. Okay, and then the last movements here, going back to the foot, if you were, say, sitting down with your feet planted on the ground, but then you decided to look at the bottom of your foot from where you're sitting. So inversion would be that motion. So the lateral edge of the foot, if you put that part on the ground, but the medial edge, you put that in the air. That's inversion. Eversion is the opposite. If you put the medial part of the foot towards the ground and the lateral part like up. That one's better shown in the picture here. So inversion, so you put this part on the outside on the ground, and then you can look at the bottom of the foot this way, but eversion is the opposite way. Then protraction is if you move a body part forward, like anteriorly, and retraction is if you move it backwards, posteriorly. So an example here is like if you did a gooseneck bob, so you like jut your chin and jaw out, that's protracting. But if you pull it back, that's retracting. Okay. And then the last one is elevation and depression. So elevation is what it sounds like. If you raise a part of the body, you elevate it. And depression is lowering a part of the body. So this would be seen if you shrug your shoulders. So bring your shoulders up, you're elevating them. And if you push them down, you're depressing them. Okay, and that is the end of the notes for Chapter 7.